just wanted you to wait till people.
Good morning, everyone, and welcome to this peer learning session on meaningful work and wealth. Really glad that you all who are here are able to join us. And as usual, it'd be great to have each of you, if you wouldn't mind, please chat in your name and your pronouns and organization or community as you're coming into this space. I think you'll find this to be a really interesting group, a couple of groups that are going to share with us today. And before we move to that, I'm wondering, Liz Baxter, if you wouldn't mind kind of doing a welcome and land acknowledgement, please.
Great, thanks, Monty. Just really grateful for you all finding time to join us today. I would like to perhaps start with our land acknowledgement and then talk about why we're doing this session. And so here in the North Sound, we adopted a land acknowledgement statement about a little over 2 years ago. So we begin by acknowledging with humility that the land where we are today is the territory of the people of the Salish Sea. Their presence is imbued in the waterways, shorelines, valleys, and mountains of the traditional homelands of the Coast Salish people since time immemorial. And you know, there has been so much in the last 2.5 years, as well as the last month or so, that continues to just highlight the importance of acknowledging the space and this land. And Michaela, who's our tribal liaison, you know, knows that we're talking about how we can deepen and perhaps do a next iteration of this land acknowledgement. So there is a link here on the slide, and I think that Stacy will put it in the chat box so that everyone can see whose land that they currently are on, or you can look up where was the land of where you went to school, or you know where your family was from. Just wanting to have that be a part of our presence always. This session is part of a series. We have been looking at the vital conditions that shape our ability to experience well-being, to have equitable well-being here in the North Sound region. We have had conversations in the past about stewardship and legacy, physical and emotional health and well-being, humane housing. And this session around meaningful work and wealth is a continuation of that discussion, really an acknowledgement that our health isn't measured by how well we do at the emergency department or interacting with the healthcare system, but there are just so many other things that are important for us to actually think that we are advancing health and equity. And so just really grateful to Monty and his team, to Alicia and our team for putting the session together. So appreciative of the panelists who are joining us, and you know, just thank you. So Monty, I will turn it back to you.
Thank you so much, Liz. Yeah, so the agenda is pretty straightforward. We'll do a light touch on kind of the thriving together approach that Liz alluded to, and kind of where meaningful work and wealth as a vital condition fits within that, and then really pivot to Alicia and a couple of our outside speakers and friends who are really generously going to share some experience around meaningful work and wealth. And then at the end, as usual, there'll be a chance to kind of kick around some ideas and reflect on what you heard and what that questions that are surfacing for your possibilities. So this thriving together framework, you know, a lot of this I think is consistent with what the North Sound has been doing for a long time. I mean, I think the land acknowledgement and the way that you all are really creating this practice within your region, but I think also being a model to the rest of the state and the nation as a way of really understanding the legacies that we've inherited. And some of those legacies we've inherited are of exclusion and trauma and harm. And really understanding how we situate our work and understanding those legacies and contexts that we've inherited. And that to really understand how we help people to thrive and well-being in a really built around these vital conditions that we know globally all people on the, on the planet really depend on for their well-being. And then this idea of stewardship is really, again, a ethos I think that's very much alive in the North Sound ACH. And as you continue on your journey, perhaps beyond the Medicaid transformation work around what does shared stewardship look like? How do we create new legacies of well-being and justice, and how do we really expand those vital conditions around expand those vital conditions so that all people are thriving? And I think the premise here is that we know that we've inherited systems, and sometimes there's systems of resiliency or assets in place, but a lot of these systems were not designed for everybody to thrive. And so that's an underlying kind of starting point. You just maybe say a couple quick things around the vital condition of meaningful work and wealth. And Liz pointed out that, of course, we've done a couple of others in the series around basic needs for food and basic needs for, freedom from trauma and addiction and violence and humane housing. And this one around meaningful work and wealth is, this kind of definition that you see on the screen here, really about personal and family and community wealth. It's about good paying and fulfilling jobs that bring dignity to people's lives. So there's a lot there in terms of what it's about. And I think that second paragraph is, just hints at the benefits of that. We know that, those things allow us to be more productive and have more rewarding days spent in our work. It's the reducing the financial insecurity that obviously diminishes our well-being when we don't have financial security, and being able to afford assets that allow us to fully participate in all aspects of our lives. We happen to be at a moment in time where I think there's wide recognition that we have an economy at local, national, global levels that are not working for a vast majority of people. And I know there's been a lot of talk that I've, just heard a little bit even in your region around what's not working, a lot of ideas and concerns about workforce around the rising costs of living, what it takes to live here. And I think nationally we're seeing, 37% of all households and 58% of households of color do not have the resources to sustain themselves for 3 months, even at a poverty level. So we, in the COVID and parts of 2020 really revealed that. This is just one indicator of some of the racial wealth gap that I think is present and that we're experiencing. There's a lot of other indicators out there, but I want to just point out that I think that this moment in time and this part of the Thriving Together framework, there's also a lot of experimentation around some new ways of thinking about our economy. And that includes big ideas around universal basic income, or, how we might really move into some different strategies for reparation. So there's some big ideas floating out there, and a lot of really interesting ideas at local and regional levels for really creating meaningful work and wealth. And I think on the next slide is just one example of a resource that we'll chat out there around equitable economies. What are the different things that we can do at local, regional, and state levels? Building Healthy Places Network is a group that's been using the Thriving Together framework and the vital conditions as well around doing this. And I think most importantly, as a setup for today, is we're going to hear a couple of examples of some really creative ways that communities can start to think about some new pathways for building meaningful work and wealth. And so on that note, Alicia, maybe I'll hand it to you to kind of kick us off with our guests.
Thanks, Monty. I'm so excited because, as Monty mentioned, we are always looking for real world examples, creative ways that people are advancing these vital conditions. And today we have with us two organizations, the Center for Inclusive Entrepreneurship and the Tribal Community Health Provider Project, who are going to share their work, both in our region, but also more broadly in the Pacific Northwest. And I think I'm most excited just because they're taking some really unique approaches to how we build wealth in a community, how we find that meaningful work for communities. So I'll invite the Marisa from the Center for Inclusive Entrepreneurship to share a little bit first, and then we'll move on to the Tribal Community Health Provider Project. And so we will have time for more questions and follow up after their presentations, but feel free to chat in anything you want to learn more about, and we'll try and cover that during today. So with that, I'm going to pass it over to you, Marisa. Thank you so much for being with us, and excited to hear more about the Center for Inclusive Entrepreneurship.
Yeah, if I can share the screen, if the host can give me permission to share, I'm going to go ahead and just share a little bit about our work. So I'm Dr. Marisa Herrera, and I am program manager with the Community Enterprise Program for the North Cascades region for the Center for Inclusive Entrepreneurship. And we work with communities that have been historically underserved and disadvantaged at different points to provide a pathway to entrepreneurship. And part of what brings me to the work is I've been a part of those communities. I am a part of those communities, and definitely have seen how difficult it can be when you don't have enough capital or resources, or you don't come from a community that has generational wealth to be able to build wealth and break out of a cycle of poverty. I think it's important to share what brings me as a Latina, Chicana, to this specific organization. I had a chance to be a board member for a number of years when I was in my former role as an executive director of community building and inclusion at the University of Washington, and got to see how the executive director, Mike Skinner, who's been running this program for the last 13 years, approached the work with an inclusive entrepreneurship mindset. He was predominantly working with refugees, folks of color, people that had been incarcerated or been justice involved, and really would meet them in a way that I think provided an easy and quick pathway to revenue. So his philosophy that he embedded in me way back then, and it's been now 6 years that we've known each other, was that, fail forward, fail productively, fail cheaply. Communities that come from not having a lot of resources, they don't need to always have a business plan. They don't need to always have these artificially, socially constructed barriers to start a business. And, I think about my own family. My dad was a panadero. If you like Mexican bread, my uncle had a restaurant, fell way behind in back taxes. And my dad stepped in and said, I'm going to take over the business. And within that restaurant framework of this building that he was able to buy from my uncle, he had a water store, he had a hair salon, and he had a panaderia. And so my dad, before his job, would wake up at 4:00 in the morning, go in. And I was in my MBA program, mind you. And I came home and helped to sell bread. And I'd be in there talking to people, and then I would go back to school and, do my accounting homework. And, my dad was like, you're always upselling people on the bread. And I'm like, nobody wants to buy one bread or two breads. Everybody wants 2 dozen, People are coming in and I'm chatting them up, and it was fun for me. But that experience encapsulated what we are looking for in our entrepreneurs. Sometimes it's tragedy, sometimes it's opportunity, but you step in and you figure out a pathway to bring additional revenue into our family. My mom at that point was very sick. It was critically important to have an additional revenue stream for our family. I wasn't making any money in my program because I was in school. And we had a lot of people that depended on us. And so it wasn't like it was this boutique hobby. It really was a pathway to pulling ourselves out of poverty. So with that, that's a lot of what brings me to the work. Being somebody from a small rural community in southeastern Arizona, being the granddaughters of miners who are labor organizers, who have always said, what have you done for the community? It's great that you're going off and getting an MBA, but what have you done for the community? And that has stayed with me for the last 43 years of my life. So CIE's mission broadly is that we offer accessible and inclusive first step business training. We're working with low income emerging entrepreneurs and micro enterprises. So what that means for us is folks that have $50,000 in startup capital, $50,000 or less in startup capital that they need to get their micro enterprise going. We help participants discover the power to launch grow ready micro enterprises to move out of poverty and become leaders in building resilient, sustainable, and equitable shared community wealth. And so how that translates for us is that we're seeking out those micro enterprises, and we have a philosophy that there is no closed door. Now, where we want to grow our work is working with BIPOC, historically disadvantaged, LGBTQ, justice involved, folks that are facing housing and food security. That's our priority. But if somebody comes to us and says, I believe in your mission, I want to be in the class, I promise to uphold the legacy of who CIE has been, that's an opportunity for somebody that wants to be in community and wants to be in partnership. And so we say, come on in. So if they're looking to start something, $50,000, and I'll share an example, a recent example in a little bit, but we had somebody that came from Point Roberts, and if you know what's going on in Point Roberts, these are folks that are cut off from a lot of resources and opportunities. I had 2 new clients that came from Point Roberts, and neither of them would fit into a definition of, who we typically serve. Not on paper anyways, but understanding the local context of what's going on in Point Roberts is what brings them to the work. They had some options, they were on unemployment, so there's some socioeconomic disadvantages. But in terms of generational wealth, the ability to access capital, probably having good credit, having that credit live in their, in the property and things that they have, but they needed somebody, and they were looking for an opportunity to try and make some money because everything was cut off. So this particular business, they're owner operated. They run a woodworking business, and they need less than $50,000 to capitalize. We do focus on underserved communities, and we give priority to those that are low income and have limited resources, and are below the poverty level. Especially, what we find is that with that, it does take a nuanced approach in making sure that we're not just wearing our business hat, but we're also operating as social justice agents with our clients, making sure that they have the wraparound support services that they need. So liaisoning with other community partners is important. When a client, like I had a couple months ago, says, I want to apply for a payroll protection program loan for my tattoo business, but right now I'm living out of my car and I don't have a computer, and I'm trying to apply off of my phone. And I said, can I come bring you a laptop? Right? Can I come to where your car is at? We can sit at a coffee shop, and no judgment. I will come and I will bring you a laptop. You can hang on to it for a couple of days or a week, whatever you need. But let's get this application in, because what that means for that particular client is the payroll protection program was a forgivable loan. That person was approved for $75,000. That helped create a pathway to housing for that individual, because they were living, they had a tattoo parlor where, they were kicked out of their house, but they still had the tattoo parlor, the physical residence. So I was like, let's think about how we can creatively problem solve with some of the other things that are going on in your life. Now, somebody at a bank is not going to necessarily do that. And I think, we are trying to create wealth for folks and making sure that their businesses are going well, but we also care very deeply about, food, water, shelter, some of the basic needs that might, not always be tended to when you're just trying to make it as an entrepreneur. It is hard to hold 2 things at the same time. When you're thinking about your basic needs, how can you possibly be thinking about risking the small amount of wealth that you do have to start a business? So our focus is on businesses that can contribute to financial self-sufficiency. Entrepreneurship, always, in my mind, entrepreneurship, even when I took it as a class in college, felt like a fun to have, not a need to have. I never have thought about it this way. And it has been Mike really shaping my ideas. My other partner in the work, who's the other program manager, Rick Dickinson, has a background in marketing and communications, and the philosophies that these people hold. I feel like I work with some of the smartest, kindest people that I've ever worked with in my career. And Micah Jonet, who works on, he's an accountant by trade, but a social justice advocate by the way that he lives. And so trying to work with our Spanish speaking community in Mount Vernon, who have farms and small food businesses, to try and get them the Flex Fund, most recently, the PPP loan previous to that, has been wonderful, because it's like, you know, where you get a door shut, we find an opening. We're trying to make sure that these aren't about hobby businesses. These are about break-even businesses that will generate revenue and can have an impact on the day-to-day lives of our community. So this is just kind of a brief overview. I think this is important. You know, CIE and the connection to the social determinants of health, you know, it's probably most relevant when we think about how economic stability fits in with things like mortality, morbidity, life expectancy. It is connected, because if you don't have the money to be able to pay the medical bill, or to be able to, you know, get dental or health insurance, then you might be paying more in some aspects, because you're paying for emergency dental care. You're paying for going to the emergency room instead of seeing a primary care physician. All of these things are connected. And that sometimes is lost when we're working with partners in the community who don't understand why we would show up for a meeting that's talking about social services. We are not a social service, but we liaison closely with social services to make sure that the folks that come to us are able to gain economic stability. And the pathway to that, the vehicle for that, is entrepreneurship. So we do this first and foremost with training. It's a very simple model: training, one-on-one counseling, and networking events. And I would say the networking events, you know, it's not a big part of our work. You know, we do our work one-on-one, client by client. So we have them come in once a month. We kick them off with an onboarding session, and this is a chance for them. You know, Mike says kick the tires on an idea, but it's really about viability. You know, they go through a 4-week program, which is called Simple Start. And they're going to bring their idea. They might be at any stage within a 2-year arc of their plan. They might be an early stage entrepreneur that already has something going, but they're not yet a going concern. Maybe they've been selling, in the case of one of my clients, during the pandemic, he was a chef or a cook prior to the pandemic. And the pandemic hit, everything closed for him. He was very lucky that he had just started a job where the employer said, hey, we'll continue to pay you. You don't have to go on unemployment, we'll continue to pay you. And so what he started doing was selling this delicacy from where he's from in Guadalajara, Mexico. It's called a jaracaya, which it's a custard dessert. I had never tried it or heard of it before this. And he said, yeah, you know, I'm selling jaracayas and I sell them to my community. I just got this contract at one of the grocery stores, you know. And so I got all in with him. I started looking on Instagram, seeing what was happening in terms of trends in LA, how other entrepreneurs had pivoted. I was very excited about his jaracaya business. And he said, yeah, I was doing a ton of catering, doing, you know, cook during the week, but catering on the weekends. I had a solid business model. And so he stepped into our training, but the barrier for him was language, right? He spoke English well, but you know, he really was already doing it. So we had him in the training program that meets every week, Wednesdays, 4 to 6, but we shifted him over to one-on-one counseling. And I was able to help that client as they were going out and sourcing some of the container vendors. So they flew to LA, were meeting with people one-on-one because they wanted to be able to bring this to market in a prepackaged food kind of way in cold storage. So that's somebody that didn't need a lot of startup. He's running a home business. He's selling it out of his house. He's selling out on most days. but now he wants to come full-fledged, but he still only needed probably $5,000. So that one-on-one counseling is still ongoing with this client. But one of the things that's been really great is North Sound Credit Union has a loan loss reserve fund that we can provide funding for any of our food businesses up to $5,000, very low barrier. And so that Harakaya business could come to me and say, all right, Marisa, I got my packaging, I got supply chain set up. He's not using these terms, by the way, right? These are my terms. He's saying, I got this guy over here, this restaurant over here that wants to buy my stuff. All right, I think that I have a pretty good business model. Will you give me a loan? And my answer to him is yes. It's not that we're not going to do paperwork. It's not that we're not going to go through the process of making sure that we have all of our T's crossed and I's dotted. But I want to be able to say yes to somebody who has a dream and has a business model that's already a proven concept. The final thing is networking. We have on the Olympic Peninsula, we have something that's been going pretty good, which is every couple of months, we come together with all of our clients, and then they talk and network with each other, share ideas so that they can have a community. Out in our area, we have, it's called RISE, and it's Real Talk for Island and Skagit. And so it's for our entrepreneurs that have already gone through the program. We just added Whatcom County and North Rural Snohomish. So we have a couple of new folks that are coming on. We have a large Latino population. And so we have 2 new staff that are going to be coming on that are Spanish speaking, and then a new program coordinator, and they start August 2nd. And so we're going to now be covering the area that goes from the northern part of the state, from the Canadian border, all the way down to North Rural Snohomish along the I-5 corridor and the islands. So I don't want to leave out my island people. These are a couple of special initiatives, and I know I'm probably butting up on time here, so I want to be mindful of that. In Skagit and Island County, we did an event in March for Women's History Month called Women Rising, and that was our first networking event as part of RISE, and it was great. We had a group of panelists. We had one woman in particular that I think of often. She has a very successful, pet grooming business, but she talked about her experience being incarcerated for manslaughter, and talked about how she chose to be back in this community because this is where she had harmed the community. She felt responsible. She felt like it was her reconciliation. It was a chance for her to give back to a community that she had impacted. And she said, I'm not like your regular entrepreneur, so please don't expect for me to be polished. And we're like, no, this is not about having a polished panel. This is about speaking our truth and talking to other people who it might hit them in the place that they needed to hear this. If they too were going through imposter syndrome, if they were wondering if they had what it took. This person now runs a 6-figure business in the community where the accident happened, the community where she was locked up, but she's been able to return to community. And that to me is restorative justice. That is the truest part of restorative justice. She's still giving back. She's one of the biggest contributors too to in-kind support, volunteering. She's out there, doing food drives and other things, and taking in strays. A force to be reckoned with in our community. In partnership with the Tala Fund, we're also designing and piloting the Cedar Root Center to catalyze entrepreneurship in the Quinault Indian Nation. And we're also building the Olympic Seafood System Alliance, which helps us to better support more inclusive and equitable seafood sector value chains in Washington. And that brings me to the end. So here's some information about how you can contact me if you have any questions, but I welcome questions as well right now.
Thank you so much, Marisa, for sharing your story and for sharing those examples of the work you're doing. I did see a couple questions coming through the chat. I'm going to pivot us over to Carrie and Katie with the Tribal Community Health Provider Project to share a little bit about how they're putting this vital condition into action, but we'll have some time to circle back with questions for you too, because I took a few notes. There are some things I'd love to follow up on. So with that, I'm gonna pass it over to Carrie and Katie to introduce yourselves and the work you're doing.
Hi, Tots Maywe. Good morning. My name is Carrie Sampson Samuels, and I'm an enrolled member of the Confederated Tribes Umatilla Indian Reservation. I live in my tribal community. We are located about 10 minutes outside of Pendleton, Oregon. So we're in the northeastern tip of the state. And I am the Tribal Community Health Aide Project Director at the Northwest Portland Area Indian Health Board. So I'm going to pass it to Katie to introduce herself as well, and then we'll get our presentation started.
Good morning, everyone. My name is Katie Hunsberger. I use she, her pronouns. I am from the Fort McDowell Yavapai Nation. My homelands are the areas around the Sedona Desert. I'm currently living in Portland, Oregon. I am the BHA, which stands for Behavioral Health Aid Student Support Coordinator. At the Northwest Portland Area Indian Health Board, working with Carrie on the Tribal Community Health Provider Project team. It's really nice to meet everyone.
All right, now I'm going to share my screen. All right. So just to talk a little bit about the organization we work for, if some of you are not familiar with the Northwest Portland Area Indian Health Board, but we are a nonprofit tribal advisory organization, and we serve the 43 tribes of Oregon and Washington. Most of the tribes are actually central in Washington, not hard to believe. There are several of the tribes around the Puget Sound, but there are also 9 tribes in Oregon and 5 tribes in Idaho that we serve. So we're trying to be inclusive of all of the states, and the work that we do also does involve a lot of the state policy work. So we work with all 3 states pretty closely. Each member tribe does have a delegate that we work closely with, and we meet quarterly with our board delegates to discuss strategic direction of the organization. The direction of the organization is really taken from our tribal delegates because we need to ensure that the work we're doing is aligning with the needs of our Northwest tribes. Our organization focuses a lot on health promotion, disease prevention projects, legislative and policy analysis, training and technical assistance. And then we have a really great epidemiology center. I don't know if for those that don't know, a lot of times our American Indian Alaska Native data is very underrepresented across the board. So our tribal epicenter really does a lot of great work in ensuring that we have good data to work with. And we all know that not only does our data inform our work, but it also helps with our funding streams. So the data that has been taken from our epidemiology center significantly helps our tribes in obtaining different grants to support their programming. The vision of the Northwest Portland Area Indian Health Board is our mission is to eliminate health disparities and improve the quality of life of American Indians and Alaska Natives by supporting Northwest tribes in their delivery of culturally appropriate, high quality health care. And this is just a visual map for you all. So I will introduce our Tribal Community Health Provider Project team. Christina Peters, unfortunately, was not able to be on the call with us today, but she is the director of our project. And then myself as the CHAP director, Miranda Davis is our Native Dental Therapy Initiative director. Dr. Donica Brown is our behavioral health director. Dove Spector, unfortunately, this slide's outdated, so she was our NDTI specialist. Tanya Firemoon was our Tribal Community Health Provider Project Specialist, Pam Johnson, our NDTI manager, and then Katie Hunsberger, as she introduced herself. So let's jump into the work we're doing. The Tribal Community Health Provider Project at the Northwest Portland Area Indian Health Board was established roughly, it's really new. So I was really listening to Marisa's stories and experiences in the work that she's been doing, and really feeling excited to eventually share some of our own stories of personal successes. But right now our project is really getting off the ground. So I'm really going to talk a little bit about how we brought this work from Alaska to the Northwest, and then how we're trying to build this infrastructure to support our tribal communities with with providers that are from their tribal communities. So I'll start by saying that our Native Dental Therapy Initiative project was initiated at the board about roughly 4 years ago. And then our behavioral health aid project that we are currently working on, we started the work about 2 years ago. And the community health aid role also under the Tribal Community Health Provider Project is a role that we are looking forward to begin the work on doing in the next year. So just to delve a little bit further into the roles of each of those practitioners, dental health aides are primary oral health care professionals that can provide clinical dental treatment, patient education, and preventative services. Our behavioral health aides are counselors, health educators, and advocates. BHAs help to address individual and community-based health needs such as alcohol, drug, and tobacco abuse and mental health. BHAs use a combination of Western and traditional based practices to provide care. So that piece of this role is really key in connecting to our patients and our community members and incorporating some Indigenous knowledge and cultural practices into the one-on-one care that they're providing. And then our community health aides, they work within the guidelines of the Alaska Community Health Aid Practitioner Manual to assess and provide emergent, acute, and chronic care to residents in their respective rural communities. So what is the Community Health Aid Project or program? The Community Health Aid Program was actually established in Alaska 60 years ago. So this has been a program that has been in place several years. And really the inception of this program in Alaska was because many communities, Alaska Native communities in Alaska are hard to reach places, and they are not typically places that newly graduated physicians or any other level of providers are, you know, that's not the first on their list of places to go practice medicine. So 60 years ago, they realized that they needed to provide, they needed to get providers into those communities due to the TB epidemic, high rates of infant mortality, and the high rates of unintentional injuries that were taking place in these remote villages. So this program was developed as a way to train their village members to provide some of those basic levels of care so that they could be more accessible to Alaska Natives in their communities. And there are actually some old videos, really interesting videos of the CHAPs in Alaska radioing in to a physician in Anchorage or Fairbanks, and they have the patient in the exam room with them, and they are telling the physician over the radio the symptoms of this patient and what they're experiencing, and then the physician is probing different questions and areas that they are asking the CHAP to assess. And then that's how they were able to access care, access the correct medication they needed to be on, or appropriate method of treatment, or is this an individual that needs to be flown to Anchorage or Fairbanks immediately? So this program was really successful in that aspect. And then they ended up developing the behavioral health aid role actually fairly recently in 2008. The very first behavioral health aid was certified in Alaska, because not only were the physical needs needing to be met, but also the mental health needs were needing to be met in these communities as well. So they began to kind of take the same model of the community health aid and deliver it in behavioral health, and then also in the dental health aid role. The providers, again, are typically tribal members from that community. The role is often generational. So when I say that, I mean that if my grandma was a community health aide, then it was a really good chance that my mom or auntie was going to take that role and become the community health aide in that community. And then there's a good chance that that role was also a role that I was going to take on and become trained in to provide that level of care and serve as my grandma and auntie did. As a personal experience to that, my grandma was a nurse, and she practiced as a nurse in Alaska for several years. And when I would go and visit her, I just was really intrigued by her stories and her experiences. And sure enough, When I graduated high school, I went into nursing school and became a nurse. So I really relate to this generational role and how we kind of learn from our grandmas and want to be like them, and then take on their career paths to be that healer and person that our community members want to seek out for care. I'm going to go ahead. And then also our providers are typically people who understand our culture, understand our traditional practices, understand our traditional foods and medicines. And they have, you know, lived in their communities, learned those things from their aunties, grandmas, grandfathers, and practice it. They practice it in their lives, maybe not daily, but are people who do go out and gather those foods, and when they're providing care to our patients, they can be that person that says, I've got some medicine for you, I'll bring it next time we meet. And it's just it's a form of connecting, and it's a form of showing that I'm willing to share my medicines with you because I care about your well-being and I want you to be, you know, to get well. And so it's just a really close connection in that aspect. So who do our community health aides, behavioral health aides, and dental health aides provide services to? It's our entire community. It's our elders, our youth, and families. There are some roles that in our tribal communities, we have 2 BHAs, actually behavioral health aides, working in Washington right now. And one of our BHAs has actually taken a youth approach, has really focused her practice on youth and providing those prevention services. So I know our tribal health facilities, our tribal health organizations are really receptive to taking that behavioral health aid and tailoring their work to where they feel like their passion is and who they're connecting with. So why does the community health aid program matter? Well, it's got a proven history of safe quality care in Alaska for 50 years. And that's really what I want to emphasize also, is that we in the Northwest are taking this model of healthcare and adapting it to meet the needs of our Northwest tribes. So as I was saying earlier, those personal experiences, those success stories are those stories that we are waiting to build, waiting to start getting filtered into our phone calls, emails, and meetings. We've heard a few here and there, but as we're building the program, we're still kind of trudging along, and we can't wait to start to hear those success stories in the Northwest. But for now, all we can do is hope that it has, as it has been so successful in Alaska, is that it will be so successful also here in the Northwest. It's a uniquely developed by Alaskans for Alaskans, and the same will be true for our Northwest tribes. And we'll get into that in just a minute, and how we're building our Northwest education behavioral health aid programs and tailoring that to our Northwest tribes. It increases the number of American Indian Alaska Native providers in our workforce. For those that don't know, there are very, very few American Indian Alaska Native doctors, nurses, dentists, really across the board of all healthcare professions. We are highly underrepresented, even in our own tribal health facilities. So we really want to make sure through this program and through this training program that we are building our workforce under our CHAP program and the CHAP umbrella, and using this education track as, I don't want to say an easier pathway for our Native students, but a more accessible and relevant pathway for them. We hope that, that it will decrease travel. Oftentimes in our tribal communities, we have to refer out services. So I know in my community, oftentimes we have to refer out our clients to Portland. It's a 3-hour drive. Then you run into accessibility, gas, transportation, all of those different barriers that sometimes our people face. And then we really hope that it essentially reaches we reach our our patients that are in some of our hard to access areas. So some of our tribes in Idaho and Oregon have larger, and even in Northern Washington have larger land bases. And there are areas that still, it's hard to believe, but are hard to access that you can only, get to by gravel, dirt roads. So really hoping to just get our community health aid providers, behavioral health aides and dental health aides out and infiltrated into our communities to provide that point of care and that quicker access to care. So we did come up upon a huge milestone within the last year, and that was essentially that it was approved, the national policy was approved to extend the CHAP outside of Alaska. The tribes in 2016 really began advocating to extend this program from Alaska. They had heard all of these success stories over the years, and we're finally like, we've been hearing how great this program has been for Alaska tribes. We want it here. We need this. We are facing many challenges, and really seemingly this could be the answer to some of the challenges we're facing in regards to getting providers in our clinics that are going to stay and be committed, and it's not a rotating door sometimes, and unfortunately that's really how it's perceived. Our people will go into our tribal clinics and kind of be like, I wonder which doctor is going to be here today. It's not that doctor or provider that you've really got to build a relationship with. It's gotten better over the years, but I do know that it's still a barrier. But anyway, essentially we got permission, per se, to begin building this in the lower 48. And there are other IHS service areas, but I will say the Portland area that serves Oregon, Washington, and Idaho has really taken the lead on CHAP across the country. And so many of the other IHS service areas, such as Phoenix area, Billings, Montana area, the other southern areas are really watching what Portland area is doing right now to see how we are adapting this model for our tribes. And essentially, hopefully this will be something that the other areas begin to take on. And I know some already are. And we'll start seeing this model of care throughout all of our tribal communities throughout the lower 48 states. This is just a quick timeline. I know I'm kind of running short on time, so I won't delve into that because I want to make sure I allow enough time for Katie to talk about the behavioral health aid education program that we are currently building with colleges in Washington, actually. And just to kind of backtrack a minute, and we'll talk also again in a minute about some of our success stories that with our students, but we've currently been sending our students through the Alaska Behavioral Health Aid Education Program and through the Dental Health Aid Education Program. And so in order to really feel like we're building this in the Northwest, it's essential that we establish our own education program that is teaching a model for our Northwest tribes. So now I'm going to hand it over to Katie, and she's going to talk a minute about our education program.
Yeah, hi again. So I just wanted to quickly define what a BHA is. And a behavioral health aide is defined as a counselor, health educator, and advocate. BHAs help address individual and community-based behavioral health needs. There's currently a high demand for mental health services access and recruitment for behavioral health workers in tribal communities. Unfortunately, there are very high numbers of suicide, substance misuse, education, dropout rates, and these are all a chain reaction within one another. And as Carrie mentioned, we don't have as many American Indian Alaska Native providers. So at the heart, the BHA program is a ladder that's less intimidating for Native students because Indigenous knowledge is weaved into the curriculum. As a first generation Native student who went to undergrad and grad school, I was most often the only Native person and didn't have access to Native specific cultural programs, therapy, or counseling. Many Native students don't feel represented in those spaces, disconnected from homelands, culture, microaggressions. And then I think all of these things can contribute to lower education rates. So how do we go about changing that? The BHA education program is unique because students will be embodying holistic care that we as Indigenous people have been using since time immemorial, but isn't usually present in westernized institutions. Students will be learning from elders, incorporating their tribal traditional practices, experiential learning in different tribal communities for in-person intensives, while at the same time expanding their scope of practice, creating a robust system within communities, and they can come to us for changes that they want made in health systems. It is truly a program that tribes are able to flex their self-sovereignty as we gain insight from students, our advisory work group, and tribal health department. We all are really working together to build this in a really effective way. So that being said, we are partnering with Heritage University and Northwest Indian College to provide several pathways for students who have a previous degree, who have a lot of work experience, who may be working full-time or part-time. We want to work and be flexible with their schedule. So we are currently working on an associate's degree pathway as well as their certificate. And some of these activities that BHAs do include smudging with their clients, gardening, building that connection with the land and traditional foods, making regalia, ribbon skirts, moccasins, Haina gathering, drumming and dancing, all of these things that are in the culture. We want them to also get in their practicum and curriculum and clinical hours. So overall, the program is helping to build a safety net for our future generations to make sure that our tribal communities are happy and healthy. Next slide, please.
Thanks, Katie. I will try to switch. I know we're running over time, so we'll probably wrap up real quickly with this slide right here, some of our success stories. To the left are many of the dental health aid therapists that are working in our Northwest tribal communities that were trained in Alaska. And then on the right are two of our behavioral health aid students that are just graduating this summer and are working in their tribal communities already. And then those listed are all working for the Yakima tribal community and are currently in the BHA program in Alaska right now. So we are really, really hope these students are doing really wonderful work in their communities, a lot of success stories just through their individual work. And unfortunately, Katie and I are less abreast to the dental health aid success stories because that's our dental health aid therapy managers gets to hear all of those. So I will just show you all our website, how to contact us and learn more. And then I know we need to jump into a Q&A. So I'll turn it over to Moni or Alicia.
Thank you so much, Carrie and Katie, for sharing. And I know it's no easy task to try and cover a really complex program in a short amount of time. So I'm just grateful to all of our speakers for tackling that challenge. And just was really struck listening to you all, the different ways that I think you're engaging groups who are traditionally underrepresented in these spaces and creating these opportunities for them to engage. And I think even though the Center for Inclusive Entrepreneurship and the Tribal Community Health Project feel really different on the surface, just hearing you all talk, it felt like in a lot of ways you're really similar because it's not just vocational training and coaching or providing loans in a bubble. It's really working with people in their current circumstances to make sure that they can take advantage of those opportunities and see themselves doing that through generations. And that's something else that really struck me is I noticed Carrie and Marisa, you both talked about your personal experiences and seeing family members as entrepreneurs, as healers, and that influenced your work moving forward. So just think that's really cool and appreciate that. I want to call out, there was a question in the chat about how people can are hearing about CIE. I know Stacy dropped in the chat a learning collaborative, an ECHO learning collaborative that anyone can join. So recommend checking out that link if you're interested in that. And then Marisa, I don't know if you have anything else to say about how people can connect clients or learn more about like the PPP program or the networking programs that are happening in our region.
Sure. So a couple things. If you, we should have put the URL for the CIE website in the chat. People can fill out just a quick form, we'll respond to it, and then we can follow up with them right away if you have any referrals. So if you have people that could be potential clients or entrepreneurs that you're working with or budding entrepreneurs that want this information right now, go ahead and either send me an email and include them whatever kind of conversation you think would be best. If it's a phone call, some of our entrepreneurs want us to meet with them in person, and if it's safe to do so, we certainly will try to do that in a safe way for our community. But yeah, you know, we are starting up our new class in September. So we take a little break for summer. And so we're on hiatus right now, but our new class starts up the first week in September. And we're going to have a really big class, and folks can access that from Zoom wherever they are in the world. But predominantly, we want them to be from Island, Skagit, Snohomish, Whatcom, or any of the places on the peninsula.
Thank you so much. And I see Stacy, so helpful, put that link in the chat as well. I just want to invite Marisa, Katie, or Carrie to reflect on, you know, thinking about the work you're doing, both to scale up and, you know, provide really timely resources like PPP loans. Like, what do you feel like are the most significant challenges you're facing in the near term or the short term as it relates to advancing meaningful work and wealth?
I'll go ahead and jump in and just start by saying, you know, sometimes changing the healthcare system or any system in general can be met with resistance. And I know that especially our dental health aid therapy program has ran into several challenges when it came to getting some bills passed in the Oregon Senate. Many actually dentists were really highly against passing the dental health aid therapy bill. And it can often come from a good place. Maybe they want to protect patients and want to rely on the dentist expertise to provide what they think is the best possible care. When oftentimes, you know, that level of care can be provided by this mid-level provider trained working under a dentist, but are able to see more patients and get more people through the door. So I know that we have been met with resistance through, and we expect to probably get some of that resistance again as we begin to build the community health aid program, the community health aid role in the Northwest, and that might be by physicians, nurse practitioners, or physician assistants that maybe feel that our community health aid training is not enough. So we do anticipate some of those challenges. We are also really just turning both the health education system and healthcare system on its head with this kind of new mid-level provider type. It's new. And so not only will we potentially be met with resistance also from providers, but maybe with our community members that say, I'm coming to access care in my clinic and I want to see a doctor. I don't want to see a community health aide, or I want to see a licensed mental health counselor. I don't want to see a behavioral health aide. I deserve, you know, this, you know, advanced practitioner to see me for my care. And that will happen. And we'll just, with time, we hope that our communities will be receptive to this level of practice, not only because they'll begin to establish that trust, but as I stated before, these will hopefully be individuals that are from their communities. So it could be an uncle coming in and running into a kid he coached in high school who is now his behavioral health aide, you know. So really our tight-knit communities will hopefully be able to come together and be able to meet at this level in providing care.
Not an insignificant challenge, to be sure. And I think this really highlights that the passage of that legislation is so important, and sounds like a really amazing opportunity to continue to expand this work.
Mm-hmm. And I think I'll add to that, you know, I was really inspired by the work that was shared from our other co-presenters, and, you know, just talking about the power in generational relationships. You know, certainly our communities are not monolithic, you know, whether we're talking about the Latino or African-American community, or we're talking about Native communities, Coast Salish people in our area, It's about finding out the unique pathways to entrepreneurship and wealth building and listening to our elders. And so offering the opportunity, we have an idea that is still very much in the building stage of things where, we have an opportunity to build off of comadrazo, or comadres it's a group of self-identifying women that come together and trust each other. But what would happen if you took your abuelita and we got a high school kid and, we said, you know what, you love your abuelita, and she has great ideas. My grandmother didn't go past 3rd grade, but she was an excellent baker and made beautiful wedding cakes. And, what would happen if the linguistic barriers were removed somewhat and you had a truly linguistically inclusive classroom for Spanish speakers or for folks that are working in community, and you said, get your grandma, get your auntie, get anybody in your life, and let's build a business together. And let's learn from each other and grow in community in this classroom. And we're going to give you the resources to be able, whether it's seed funding, to kick this off. But we've been mulling about this idea of multi-generational households coming into our program and creating an entrepreneurship network of grandmothers, mothers, sisters, cousins, and neighbors working together to create a new business venture, hopefully with the goal is elevating themselves out of poverty. But what my grandparents have passed at this point, but what I wouldn't have given as a high school student to do something like this for my grandmothers, I learned so much from them. So, that's an idea that is stealable. That is something that take that idea and run with it, whatever space you're in. We need to be building off of the generational wealth, the knowledge sharing and dispersion of the things that our grandmothers hold and, elders hold that we need to amplify and hold up as valued parts of our pathways out of poverty.
That's amazing. And I want to invite other participants on the call today to share their reflections or, as you've been hearing from our speakers today, are there any particular questions that their approach, their work is servicing for you and the people you're serving? So I just want to open that up. If you have thoughts you want to share in the chat, or if you want to unmute yourself and share those, I'll take a moment and see if anyone wants to share. And I'm seeing lots of appreciation for our presenters, so I appreciate that. While we're reflecting on this, we've talked a little bit about the challenges in the short term. I'm wondering what you see are some opportunities to continue to build momentum and really move this forward.
So I think some of the short-term opportunities are really met with the fact that our tribal communities and tribal health organizations are resilient, creative, and really we're experts at doing really amazing things with not enough resources. We've gotten really, really good at that. So our greatest opportunities are really harnessing the energy and individuals and structures within our tribal health system of care in implementing our community health aid program and providing education opportunities, new education opportunities, in fact, for professional wage jobs that are for our tribal citizens, for our tribal members. So that for us is most definitely it's a short-term opportunity, but in the long term, I really feel it's going to provide happier, healthier households in our communities because we've got these providers making with professional wages that are supporting their families. So that for us, I think, is a short and long-term opportunity in itself.
Yeah, Alicia, there are like two thoughts that are circling for me. One is this relationship that Carrie is talking about of how you actually build wealth in your community. How do people become independent and sturdy in their own households and families. But the second piece, and they're just so intertwined. When I was growing up, I didn't see people who looked like me serving me. Everyone who served me was from the white dominant culture. And I just think the power of seeing how that is what I see as an opportunity looking forward. Where do I think that I will be as I grow up, as I am looking for my future? That all of these things that both sets of panelists are describing, it impacts the next generation. It impacts, like, what do I see as being possible? But the fact that we've connected the meaningful work and the wealth, is really significant, because if I don't have a launching pad, if I don't have people who are willing to invest in me to get there, it just makes it that much harder. So it's been really fascinating listening to the panelists. So thank you.
Yeah, and I would add to that, if we're thinking about how we can advance this as a region, just taking some of the lessons learned from these two projects around what are all the wraparound supports that need to happen to get someone to a place where they can apply to the job that's meaningful for them, where they have the childcare that they need, the support they need to get to even know that loans are out there, and then to have the technology and the language support to actually access them. It's really some of the themes I'm hearing, and the things that I know that our partners are already doing, is working really closely with folks to navigate those different systems. So yeah, I'm really interested in this idea of how do we approach that more regionally, so that each individual isn't having to figure that out alone.
And we would love any referral partnerships. We would love to establish more memorandums of understanding where organizations that are providing direct service could send clients our way if they feel like it's a good fit in terms of where that person is in terms of their life. So it's no cost. It's simply a referral partnership.
Any other thoughts, questions, things we didn't get to cover in the presentations folks are wanting to hit on?
Can I add like one more thing?
Sure.
I would, just because of the topic, I think that the leadership of, just how much we have been graced by tribal leaders in our region. I know we didn't talk about the DHAT program, but the fact that the DHAT program, just like so much of the impetus being led by Swinomish and the work that they're doing, that we might actually, soon have a DHAT program sitting at Skagit Valley College. I mean, like the work that has occurred that has included appeals, to CMS and up through the, Trump administration, et cetera. Like the notion that this is even happening is really embedded in tribal leadership. And, we've done like a teeny part in partnering with them. We helped, the Northwest Portland Area Indian Health Board with the purchase of the curriculum from Alaska, so that we didn't have to rebuild the curriculum. But, there is so much that's occurring in this space because of tribal leadership. And, just didn't want to like leave that unsaid, because it's enriching us all as this work moves forward.
Thank you for calling that out, Liz. I will definitely echo that. I think the work that's happening there, it's a model that we can all learn from and really scale up. And I think so many of us will benefit from that. Monty, any final thoughts you have to bring us home?
Yeah, I just, echo the gratitude for being able to listen in to both the personal stories and kind of what you all are doing. And I find it really interesting, there's these inspiring possibilities, but they are infinitely doable. There's some really pathways to action that I think for me that's most inspiring. And I think the BHA and the CHAP program is a really interesting connection to the work that the North Sound ACH has been up to from a clinical perspective, and really seeing how that's connected to a much larger set of vital conditions and thriving. And so, as all of you spoke so eloquently about, this has got to be bigger than just the economy. This is about so much more. It's about justice. It's about inclusion. It's about building community. It's about, restitching together intergenerational approaches. So to me, that's where this at. I think that's the spirit of, where do we go with meaningful work and wealth? I think the thing that I'm left with of curiosity is, a lot of the stuff that we know doesn't work about our economy, where we have both glass ceilings and glass floors. We don't have a lot of social mobility or even downward mobility. We've kind of created a system that doesn't work with folks. It works for a very select slice of our population. And you all are, I think, finding really creative ways to kind of break through some of those, and just wonder what that might mean. There's already work happening in the North Sound area. What would it look like to start to really scale? It seems like some pretty interesting partnerships as the North Sound ACH moves forward in linking this with other vital conditions. So thank you, so much, Marissa and Carrie and Katie, for what you're doing and letting us all learn together.
Yeah, so grateful, and just want to note we're going to put the recording on our website along with the resources related to both of your programs for folks who want to revisit that. And would just echo that, investing in workforce and people in the workforce who represent everyone in our community is an area that's a high priority for North Sound ACH moving forward. And so feel really inspired by our speakers for giving us some ideas of how we can do that. And to our partners on the call, definitely, I think you'll be hearing more from North Sound ACH as we try and invest and scale up different ideas. And so want to thank everyone for joining today and listening in.
Thank you all for the opportunity.